So the idea of the Psychiatric Assistance Line really came about because of the extreme shortage of child adolescent psychiatrists in the United States. So that initial assessment and treatment of children with psychiatric disorders typically ends up happening in the primary care setting. So to help prescribers, the PAL line was created so that physicians have immediate access to a psychiatrist to either treat the child within the primary care setting or to make a referral to a specialist in the community. Our typical calls come from pediatricians, family practice physicians, nurse practitioners, and sometimes even emergency department physicians. We also offer consults to prescribers who are treating pregnant and postpartum women who are taking mental health medications as well. And then for our triage and referral part of our service, anyone in the state of Minnesota can call PAL for help finding mental health resources.
And then the triage therapist will ask you a few questions about kind of what's going on with the patient, some demographic information, and either if it's something the triage therapist can help with, for example, types of therapy or resources, we will help you with that. If it's more of a medication or diagnosis kind of question, then we have our psychiatrist call you back. And again, it's at the time that works best for the provider.
What they appreciate is how quickly we can get the consultation set up, because they can literally call at 1 o'clock in the afternoon and I'll be on the phone with them by 1:15. It's not, oh, you can call back in a week and then we'll talk about it. This is same day, same afternoon decisions on.
Another thing I really enjoy about working with PAL is that it's an innovative and dynamic program. We're coming up with some creative solutions for a healthcare system that's strained. In fact, we have other states that call and ask how we set up PAL, how we're keeping it going, and how they can replicate it, something similar in their own state. So that feels good to be part of some cutting-edge programming. I believe the work that we do has an impact and makes a difference for families and providers. I recently talked with a provider in the Brainerd Lakes area who called to ask about a suicidal child they had in their office. The provider wasn't quite sure what questions to ask or how to assess risk. They weren't sure whether to send them home or send them to an ER. So I was glad to kind of walk through with the provider how to appropriately assess risk and then kind of explain the process, what the next steps might be in the process to making sure that child is safe and getting the care that they need.
Being able to be a part of bridging that gap in the care that is needed for the whole state of Minnesota makes it feel like we're really making a difference in mental health care.